Hey everybody, Rishi Bhardwaj with Bhardwaj Health, and just wanted to reach out to everybody and kind of go through a topic where I guess I get a lot of questions in the hospital about, diets, what to eat, what not to eat, what works best for me based on my medical condition, what can I do to prevent me from having a stroke or a heart attack in the future. And that's a very broad topic. There's a lot of fads that are out there. A lot of people jump in and out of different diets. The Atkins diet, the keto diet, the paleo diet, intermittent fasting, Mediterranean diet, and all these things. They all have their merits. And I think that you should probably stick to something you can do long term. It should be something enjoyable, something that you can have fun with moving forward. Because ultimately, most medical conditions are a response to stress and stress habits, right? And so as we walk through these diets, keep in mind that I still want you to focus on reducing stress, being mindful, doing meditation practices, breath work, spending time in nature, spending time having fun with your family, your friends, not watching something that's fearful, scareful, having a little bit of fun in life. At the end of the day, we don't know what tomorrow brings, but we can live in the present moment. And if you live in the present moment and stick with our blessings in our life, I think that that will keep you happy no matter what. So beginning with the diets, I guess if somebody asked me name me a diet that you could sort of encompass everything in and or recommend for a lifelong process of self-improvement, I would probably say that the Mediterranean diet probably sticks out the easiest. They're heavy in greens, legumes, vegetables, low in red meat, low in animal fat, healthy nuts, non-processed. They still use healthy oils, healthy cheeses, a lot of olive oil. And I think another aspect, it's not just about the diet itself, but is the idea of how to enjoy your food, being in a state of comfort with your friends, with your family, and sort of turning off your phone, enjoying the moment. I think it's not just the diet itself, I think it's the culture too. So you remember that it's not just about eating a Mediterranean diet and you're stressed out on your phone answering some emails, and talking to somebody else, watching TV or doing something. It's about having an enjoyable process. So the diet by itself is perfect. It's well balanced, something you can do long term. Again, heavy in seafood and lots of vegetables. I would say it's probably more 70% vegetables than anything else, and low in red meat and processed meats, no sugars. And this theme of no sugars is probably going to be something that you see throughout almost all diets across the board. So that would probably be my number one pick if I were to say, hey, this is something that you should probably do or look up and follow through the rest of your life. And next would on that list, again, these are just diets that are just going over. I'm not, I'm trying to just give a little bit more information for somebody just looking at what might work best for them. The keto diet, which is probably the newest thing on the block, it kind of follows the Atkins phenomenon of low carb. And so in this diet, it's the other calories which you're getting and where you're getting it from, which is kind of the critical difference. In Atkins, they heavily focused on just the low carb state. But in the keto diet, it's low carb, but it's high fat. So you're taking most of your calories from fat. So it's a typical breakdown is probably 70% fat, 25% proteins, and 5% carbs. And the idea behind a keto diet is that you're changing the way you utilize or you create energy. And instead of using glucose, which comes from carbohydrates, you're switching over to fatty acids, and which come from fat, which get converted to ketones, which is a slow burning fuel. And there are studies that suggest that, especially for the brain, it's very useful. It reduces excitability. It's helped with patients with epilepsy, and it helps reduce inflammation by different mechanisms. And so if you have some medical issues, neurological issues that, you may want to consider trying or want a diet more geared towards that, you can probably consider trying a keto diet. But again, the idea of very high fat and, I think a lot of people are using it to add in protein, very high animal fat protein in it too. So long term, I don't know whether or not it's a sustainable diet. You will yo-yo through the diet, and other side effects, dehydration and things like that can occur. So be very careful if you have medical conditions. It does work. It does help reduce weight. And again, from a neurological standpoint there and anti-inflammatory standpoint, it does help. And then if you're into the whole functional medicine world, I think you've probably heard of FODMAP, low FODMAP diets, and it's FODMAPs is just a group of different carbohydrates, basically pretty extensive, and it goes over different types of wheat, legumes, milk, yogurt, cheeses, sugar. It almost basically covers every single carb. Obviously, there's some good carbs. You can still have, some brown rice, quinoa, buckwheat, some fruits like bananas and oranges, papaya. So, it is, again, a more intense diet. And again, I would probably reserve this for somebody who has a lot of gastrointestinal issues, bloating issues, irritable bowel disease, inflammatory bowel disease. And this diet, I would probably utilize if somebody has already tried the basics. And when I talk about the basics of food avoidance, I would say, excessive caffeine, excessive alcohol, excessive processed sugars, high fats in your diet, gluten, some basic, dairy also, just some basic ones I would probably avoid first before going right into this, because I think if you have irritable bowel disease or any kind of bowel discomfort, if you knock out gluten, processed sugars, dairy, high fats, animal fats, you would probably start feeling quite a bit better by just doing that. And I would try that out first for at least a good 6 to 8 weeks before moving into something more aggressive like the FODMAP diet, the low FODMAP. And again, once you've done a diet like this for 6 to 8 weeks and notice some improvement, please keep a diary, because if you have, obviously I don't want anybody to have to stay on a diet like this for the rest of their life. I want them to be able to reintroduce these foods, but you want to reintroduce them very slowly. Write them down. Be very careful about introducing these carbohydrates very slowly into your diet, and making sure that you write down exactly what you're eating one at a time and introducing it slowly. And other than that, just listening to your body. I would say, again, food diary is critical. Keep in mind how your body feels after you've eaten something the night before, the day before, the day of, when you start feeling discomfort. And food diary, and then also kind of keeping an idea of what's happening in your life, right? And, any new stressors and arguments, something that can always trigger some form of stress, because that can obviously cause worsening of your gut issues. So making sure that you build the connections of not just the food, the food and the effect of the food on your body, but also what you're thinking and how you're feeling during those periods of time also prior to that. There's something, I guess people talk about nightshades. They belong to a certain type of family. They grow in the shade. There's potatoes and eggplants and peppers and things like that. I'm not too sure if that works or not. You can always try it. Again, this is a stepwise process. If I were to say, if you had a lot of GI issues, inflammatory conditions, reducing, again, going through the big guns here, going through the gluten, going through the dairy, the sugar, the high animal fats, reducing all those first, and then maybe trying to see if some of those nightshades, again, like the eggplants, the white potatoes, sweet potatoes are fine, and just kind of seeing if that kind of helps you out. Keep a diary again. I always emphasize keeping a diary because we always, things happen and then you're like, oh my God, I need to just, stop eating everything, right? And so just, it's a stepwise process. So take your time. Don't be hard on yourself. If you've had bad days, it's okay. But if you're going to stick to any of these diets, try to do it for at least a good 6 to 8 weeks without breaking, because you won't notice a difference until you do it for at least a couple of months. Other interesting things that one of my favorites is, besides doing a Mediterranean diet, is not really a diet, but it's sort of a lifestyle. It's intermittent fasting, and there's a lot of research done on intermittent fasting and why it works. Going to the biology of it all in terms of physiology and evolution, it makes sense because most of us, from a biological standpoint, have eaten for 6 to 8 hours during the daytime, and then nighttime comes and we all go to sleep. And that's how evolution started. We never had all these, lights around us 24/7. We never had TV blaring in the middle of the night. We didn't have access to all our, electronic devices and things like that, staying awake late. So from a biological standpoint, physiological standpoint, it makes a lot of sense that, during a certain period of time we were eating, and then we didn't eat. We didn't have light. We didn't have ways to snack in the middle of the night. Our food was scarce. So, our body learned to burn fuel in a certain way. And, especially carbs, because carbs is one of those things where, it causes insulin resistance if there's too much. Excess sugar gets stored into fat tissue, and if you always have calories in your body in terms of carbs, you're not going to be burning those calories that are stored in your fat tissue. So this kind of helps your body sort of change its state so that instead of burning glucose throughout the day and storing excess glucose into fats, during nighttime, those sugars from the fats get mobilized and you're burning again more fat. And again, that's better for your brain because excess glucose is linked with inflammation in your body too. So, those are kind of the basic diets, obviously exercise, mindfulness, like we talked about early on. Keep your life simple, keep it happy, keep it joyful, but, don't stress yourself out too much about all this stuff. Again, like I said, keep it simple, start with a few basic things, do it for 6 to 8 weeks, keep a good diary. Always practice your stress relief techniques. And, if you have any other questions, feel free to reach out to me. My name is Rishi Bhardwaj. I'm at bhardwajhealth.com. Email is info@bhardwajhealth.com. Take care, and wishing you all the best.